Dr. Abair, first and foremost, when you look at this bill, your assessment of its impact.
Well, it's garbage. That's just plain and simple. I mean, basically what happened is that the Republicans took $1 trillion away from people that couldn't afford health care to begin with and gave it as a tax break. We know that people across the United States benefited from the Medicaid expansion, and the states that didn't expand, they didn't do as well. We know that. And so what you're looking at now is that, they're leaving it up to the states. We know what happened last time when they left something up for the states, right? It was the Civil War. We can't leave this up to the states, because the states have other things that they may be trying to do, which really may not be trying to protect the least of our brethren. You understand what I'm saying? Because when they get a cold, we know black folks get the flu, and that's the way this is going to be. This bill has done so much to dismantle things that we built. I mean, we're talking about maternity care, we're talking about preventive care, we're talking about prescription drugs, all these 10 benefits that Obamacare, or Affordable Care Act rather, made mandatory. This bill makes them not mandatory and leaves it up to the states. So, the women, older people, they're going to feel it the most, because with the old bill, with the Affordable Care Act, people over the age of 65 could only be charged 3 times as much for the same care. Now that's gone up to 5 times as much, and it has no cap. So that means that the people that really need health care the most are going to have some issues. And what we also know is with black folks, with the credit issue, if you go to the hospital and you can't afford it, then it will destroy your credit. And that's the last thing we need, is black folks not being able to buy houses because they had to go to the hospital to get their sugar checked, if you know what I'm saying.
Well, as one of the points I made yesterday on ABC, we have seen bankruptcies fall by half as a result of the Affordable Care Act. It was a high of 1.5 million before the bill went into effect. It's now about 770,000. And bankruptcy attorneys say that is largely due to people not having to file bankruptcy due to health care costs.
That's right. That's absolutely right. I mean, and the thing about the states is that you're going to pay me now, pay me later, Roland, because this is the issue. If you get sick and you don't have preventive care, right, you're going to go to the ER anyway. And if you don't have money, the state is going to have to see you. And that's by the time you get to the ER because you're so sick, that's going to be tertiary care and surgery and an ER bill. And somebody's going to have to pay for that. The state has to pay for that. So if they do it at the beginning and give you preventive care, then we prevent all that stuff. So you're going to have to pay me either way. And if you pay me early, you don't have to pay me as much. But it's going to be a real issue. But I don't want people to get too alarmed yet, because I don't care what Reince Priebus has to say. This bill, when it gets to Senate, these senators, Republican senators, they're not trying to hear this. So I think that it's really going to be changed a lot if it goes through at all.
I actually disagree. I believe folks should be alarmed, because I'm not going to trust somebody to take a bad bill and make it slightly better. A bad bill made slightly better is still a bad bill.
I agree with that. I agree with that. I just I think that folks at this point, people gonna go out there. We know that if you get stressed out right now, which is an issue, if you get stressed out right now, you're gonna increase your cortisol level, and then you're gonna have a heart attack before we even know what's gonna happen. So I want people to be on alert. I don't want people to have a heart attack out there.